Hey everybody, it's Hannah at Dr. Handy's office. I'm here with Lane, who's a PA student who's been working with us. And this month, February, is American Heart Month. So we're going to talk to you about heart disease. Heart disease is a very wide term that reflects a lot of different diagnoses. So the easiest way to break it down is to break it down into 5 categories. The first one being coronary artery disease. This is probably what you think of most often. It's when we start talking about plaque buildup, calcification, things like that affect the blood supply to the heart, with the ultimate consequence of coronary artery disease being a heart attack. The next one is arrhythmias. So this is when your heart's beating out of sync. It's either beating too fast or too slow or irregularly. And this is when we start talking about things like AFib. Next, we have valvular heart disease. This is when you hear words like regurgitation, stenosis, prolapse. It's when the valves in your heart, they're either too stiff, they're too weak, or they don't close properly. Next is cardiomyopathies. So this is muscular disease of the heart. Either the muscular walls are too stiff or they're too weak. They're not pumping the blood properly to the rest of your body. So this is when we talk about heart failure. And then the last one is congenital heart disease. So these are structural abnormalities that are present from birth. And this is a lot of talk about a lot of different heart diseases. So Lane, why don't you tell us why we care so much about heart disease?
It is the #1 cause of death in the United States.
So it's a pretty important topic to talk about. So if you know you have heart disease, what should our patients do about that?
Well, if you know you have heart disease, make sure you are taking your prescribed medications and make sure that you are following up with your cardiologist. Also, it's important that you're going to your regular checkups with your primary care provider and ensuring that you're receiving routine monitoring for that disease.
Absolutely. What if the patient doesn't have known heart disease, but they have symptoms of heart disease, such as chest pain, shortness of breath, fatigue, dizziness, feeling those heart palpitations, the irregularities? What should they do then?
Make sure you go to your primary care provider and tell them everything that's going on. Tell them all your symptoms and lay it all out for them so they can do an appropriate workup and start treatment if needed. This will prevent any major coronary events and prevent a lot of the issues that Hannah mentioned at the beginning. Also, preventative treatment is the best form of treatment.
So with preventative treatment being the best form of treatment, if a patient doesn't have heart disease, they don't think they have heart disease, they just want to get ahead of it, prevent it from happening, or even if you do have heart disease and you just want to prevent worsening of disease, what are some things that they should do?
The best way to prevent disease and prevent worsening of the disease is lifestyle change. #1 lifestyle change: if you smoke, stop smoking. Every time you smoke, not only do you damage the lungs, but you also damage arteries all throughout your body, which increases your risk of heart attacks and stroke. So make sure, stop smoking. Another thing, move your body 30 minutes a day at the minimum. This reduces metabolic dysfunction and inflammation, which will reduce risk factors and comorbidities. Eat clean. Focus on a diet that is high in healthy, unsaturated fats. These are like avocado, olive oil, salmon, trout, tuna, nuts, and eggs. Also, eat your fruits and vegetables, specifically those high in fiber. And when you're buying your red meat, make sure you choose low-fat options. Limit your alcohol consumption. Alcohol impacts your triglyceride levels and raises your blood pressure, which are 2 major risk factors for developing and worsening heart disease. Also, make sure you're getting some good sleep and manage your stress levels. Not doing so will raise your blood pressure. Also, go to your primary care provider and get in regular lab work. We can keep an eye on risk factors and make early interventions if needed. Drink your water, 6 to 8 glasses of water a day at a minimum. Also, don't forget, you cannot out-supplement poor diet and a lack of exercise. Take your fish oil, your fiber, your magnesium, your CoQ10, but you have to change your lifestyle as well. Also, manage your comorbidities. Heart disease has a lot of comorbidities. Some of the top ones being diabetes, hyperlipidemia or high cholesterol, kidney disease, and even depression. The healthier you are, the healthier your heart will be. One last thing, if you're over 50 years old, make sure you go get a calcium score. It's a simple scan that can tell you if you have plaque buildup in the arteries of your heart, and it is the best $49 you'll ever spend.
And these calcium scores, they're actually free for American Heart Month between February the 14th and April the 14th. So you got a couple months window of opportunity. If you've never had a calcium score, you'll have to have an order from your doctor. So if you're one of our patients, come in and see us, we'll get you an order. If you're not one of our patients, go see your primary care provider, let them get you an order for a calcium score so we can check up on your heart.